Barsoumian.
Hi, I'm Dr. Elizabeth Markelz.
And we're two infectious disease physicians here at Brooke Army Medical Center, and we have a couple of guests with us.
Yes, I'd like to introduce Ms. Carrie Matthews, also known as Ms. Carrie, in the adolescent clinic at Moreno Family Medicine.
And then we also have Colonel Renee Matos, and Dr. Matos is the Chief of Pediatrics and a pediatric intensive care physician.
Hi.
And so we have these two guests here today to talk to us a little bit about what they're seeing and what they're noticing with RSV, Respiratory Syncytial Virus, and influenza.
I guess I'll start by saying just some facts about RSV. It was discovered in 1956. It's a very common respiratory virus. It's very contagious, and it can affect infants or all ages. It's commonly spread by droplets. If it enters your nose or your mouth or your eyes. So it's best to try to distance yourself from sick people. It can live on surfaces a little longer, so we want to wipe down doorknobs or elevator buttons or our mobile phones. We want to try to keep our hands out of our face if we're not washing them. Another way to protect yourself and your family is by covering your cough or your sneeze with your elbow or within your inner arm versus a tissue or your hands. It can really affect our infants and older adults. Most people get RSV under 2. Older people can get it as well, but it's not so severe. Most of the symptoms are runny nose, sneezing, coughing. For others, it could be a decreased appetite or decreased activity, some wheezing, and decreased activity. If you notice that in your babies, those are some things to watch out for. There's no vaccination for it currently, but there's over-the-counter things that you can do to help manage the symptoms, like fever and keeping well hydrated. And we'll see what else someone else has to say.
Thank you.
Thank you
Ms.
so much.
Carrie. So, Dr. Matos, as an intensivist, can you tell us a little bit more about how RSV is affecting our community?
Yeah, so right now RSV and flu and even some COVID are really impacting pediatrics because we have had a lot higher percentage of kids ending up needing to go to the hospital. So they've needed to be admitted to the hospital and even to the intensive care unit. And so what that's done is across the country, we've had shortage of beds for pediatric patients, both for medical surgical patients, so on the wards, and also especially in the ICUs. And so that shortage has been throughout the country, but even here in San Antonio. And so we regularly communicate with all the hospitals in town to know who has beds on which days, and so we can let them know when we have beds so that we can bring our beneficiaries here and make room for other patients at the other hospitals.
Well, thank you so much for all your efforts in opening up our PICU this season. It's certainly been really critical for our mission.
Yeah, very timely. And so, the unusual thing that we've been hearing about in the news is that it's a bad influenza year and a bad RSV year. Have you noticed that as well for inpatients or outpatients?
Yeah, absolutely.
Yes.
Yeah, we've seen that both in the inpatient and outpatient. We've had kids boarding in the ERs because there's not beds, long wait times in the ERs, and then also because there's been medication shortages with the supply shortages, supply chain issues, so that's been an issue as well. So some of the medications that we sometimes use for flu, or even some secondary bacterial infections, we've had shortages in the liquid forms of those for kids, so that's especially been an issue as well.
Yeah, as an adult ID doctor and watching our daily positivity rate, I have never seen this much flu since I started practicing infectious diseases at this time of year in San Antonio. Ms. Carrie, how would if someone needs to get the flu vaccine, how do they get it?
So for our adolescent clinic, Fort Sam, the Moreno Clinic, you can walk in for flu vaccines or any other vaccine Monday through Thursday from 8 to 3:30. And on Friday, we start off a little bit later, and they can come in at 9 o'clock and to about 12 to get a COVID shot by appointment as far as vaccines. And then we just want to remind everyone to make sure that if you are sick, to stay at home if that's possible, and to try to have a distance between yourself and someone sick, and of course washing your hands before touching your face. Those are some really helpful things that you can do to prevent the spread of RSV as well as the flu virus.
Yeah, it's terrible to have two respiratory viruses with high activity at the same time, but the useful thing is that the preventative measures work for both. Particularly with the holidays coming back up, people are going to have a lot of gatherings. It's very important that we try and stay healthy these next few weeks so we can enjoy our holiday plans.
And for pediatrics, so for those that are a little bit younger than the adolescents, how can they get their flu vaccine?
Yeah, so we also are giving walk-in flu vaccines in the pediatric clinic at BMC. You can also get flu vaccines in the community. So Walgreens, CVS, HEB, all of your local pharmacies that take TRICARE can also give your flu vaccines. We're also giving the COVID vaccines, including the bivalent COVID vaccines down to age 5. And so that's also another thing that's important as well to keep yourself healthy.
Yeah, I live a little bit far away from Post, so I got my kids their flu vaccines on the economy. I actually booked online, which was really helpful because then it would automatically sort me to the pharmacy that did vaccines for my age group, and so it wasn't the most fun way to spend a Sunday afternoon, but it was pretty useful.
Yeah, my kids did it at the flu fair when we had it, and then also another one came in and made an appointment and got one. So, yeah, lots of options. We'll get your kids vaccinated.
Yeah.
Yeah, I think that's the important thing is really that vaccines have become very readily available, and so try to get everyone vaccinated because it is a busy year with respiratory viruses, and I have noticed that even COVID, the rates are increasing again.
It is.
Yeah, I have one home with COVID right now.
Yeah.
Oh, I'm so sorry to hear that.
Yes.
Yeah. Well, hopefully everybody else stays COVID free. I've been able to do that from time to time when the kids have gotten COVID. I've been able to keep all the other kids free from COVID, which kind of like spreads out the inconvenience, but it helps keep everybody healthy so you don't have more than one sick kid at the same time. So.
Yes, yeah, we've been able to isolate well. So
yeah.
Same in my house. We had flu earlier this season, and we were able to isolate and keep the adults and my mother who lives with us also flu free.
Yeah.
And we were vaccinated.
All right, does anyone else have anything they want to share about flu or RSV or staying healthy from respiratory viruses this holiday season?
I think the only other thing is just to know when to come in or when to see your doctor. So obviously, fever-reducing medications can help. Motrin, Tylenol are great. But if you're noticing that your child seems dehydrated, so not having good urine output, not making good tears, dry lips or mouth, or if they're working really hard to breathe, if you start to see their chest sinking in between, or their belly working really hard, or they're breathing really fast, those are all really important signs that you need to bring your child in to be seen.
Sometimes in infants, the only symptom sometimes that is where you could see is difficulty breathing, and sometimes they are just irritable, or they just have a decrease in activity. So you just want to monitor them closely.
Trust your gut. You know your kid's the best.
Right. Absolutely.
All right, everybody. Well, thank you so much for joining us again, and thank you guys for spending some time with us this afternoon.
Yeah, thanks for having us.
Thank you.
Thank you for coming.